I think what attracted me to the profession was partly not being afraid of it. There tends to be apprehension on the part of younger folks getting into it, and that was not ever really the case for me. I had loved ones and very close loved ones that were in nursing facilities as I was growing up, so it was never something that I tried to shy away from.
When I was in college, I worked as a dietary aide and as a CNA, and really felt that things could be different in the nursing home setting that I was working in, and set out to change the world and wanted to make a difference.
Initially, what attracted me to long-term care was my passion for fiscal management, my passion for leading and mentoring teams, and my passion for overall administration. Now, what attracts me to long-term care is definitely the residents.
I think the most valuable learning experience was the program that I went through in college. Well, really learned a lot about the industry, learned a lot about caring, and so that was fantastic. And I think the ultimate thing that prepared me was just jumping right in. So I think that's the best way to kind of prepare yourself for what you're going to be doing, is just actually doing it every day and just kind of being involved in all the processes, not just one or two.
The most valuable learning experience that I have underwent was my first day, and I thought I'd go walk into the dining room and go visit some residents, and as I get there, one gentleman pulls me over, he waves and says, "Come on over and visit with me." So I sat down and visited with him, and he said, I want to tell you something. I want to tell you how important the staff are here. He's talking about how all the staff are their friends, his friends. He's talking about the love they show, the compassion, and how big of the hearts that they all have. And so it was at that point that I knew that long-term care was all about love and compassion.
Absolutely, the most rewarding part of my job is making a difference in people's lives. It's easy to make a difference in residents' lives. It's pretty easy to make a difference in families' lives. But what I wasn't expecting was the difference that I could make in staff's lives. And I found that very rewarding, whether it's developing the nursing assistant through nursing school or seeing my department heads through an AIT program. I really enjoyed developing my staff.
If you're considering a long-term care career, do it. Everyone told me, don't do it. They'd say to me, you're too smart for that. You should go into another field. You can make more money. And I just have found it to be just an opportunity to give back to people every single day. People will say it's depressing to work in long-term care, and I think it's the opposite. I think it's inspiring, and it inspires me, and I love to inspire others through it as well.
I think the best advice I could give somebody is really make sure that they have a mentor, somebody that can help guide them really from the beginning of their career, somebody that will be there for them really to help show them the ropes. And I think secondarily is making sure that wherever you are, that you're always a very visible part of your community in your own facility, because that's how as a leader, you best connect with your patients, your family members, and the staff to be able to make sure that you provide person-centered care and that you produce really good outcomes to make sure that your patients and residents are well cared for.
The advice that I would give someone coming into long-term care would be get involved, whether it be in your state agency, whether it be at a national level. Get involved. Not only do you learn lots of things from these agencies and these organizations, but you also will get good friends.
Greatest advice I could give to anybody that's considering it is to make sure that if you're at that line of determining where you want to go in business, in management, check yourself first. Make sure that you have that heart, that passion, because if you do, this is the industry for you.
It's critical that as a long-term care administrator professional that you understand how healthcare works in all venues and making sure that you're able to walk the walk and talk the talk, be able to as a professional understand how care transitions occur from one care setting to the other, and ensure that you have the skills and the education and the resources to be able to navigate all of those changes which are forthcoming and which will be an inevitable part of our industry.
Determining what are the core competencies is just indicating that they understand, and the industry understands, that while the continuum of healthcare is becoming more and more integrated, more and more intertwined, and evolving, that the profession itself needs to evolve as well.
What excites me about the core competencies is thinking about that we're not working in silos anymore, that really as a field we're working together, so we'll really have an umbrella to really cover all of the different services that we offer, that we're not going to be nursing homes separate from assisted living, separate from home and community-based services, but all those are coming together under one umbrella.